Hello, and welcome to the Ovarian Club, a glimpse into conversations between two besties across countries, South Africa and France, tackling the trendiest women's wellness topics through a scientific lens. Join me, Dr. Taryn, and health expert Emma as we explore delicate subjects related to the women's health space. We started this podcast to share our conversations to help navigate the complex women's wellness world. We hope you enjoy the podcast and take away as much from it as we've enjoyed making it. The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. So, my follicle friends, let's begin.
How's it, Ta?
Hey, how are you?
Good. I'm happy it's a long weekend, and I am looking out at the sea, which always makes me really happy. And it's not such beautiful weather over here today, but really happy for the weekend and excited for our topic today. How are you doing?
Yeah, well, jealous you're in the south of France, although Cape Town is looking pretty fresh this beautiful Saturday morning. So I'm very much looking forward to all the 101 arrangements I've got lined up over this glorious long weekend. I'm now entering into my follicular phase as a continuation from the previous episode. So feeling the best version of myself, super energetic, and just ready to see what the weekend has in store for me.
I don't know how you do it, honestly. I have one social arrangement and I need recover the rest of the day. There you are, extroverts, introverts. But
yep.
I'm very excited to talk about our topic today, which is on infertility and fertility, which is building on the episode that we had on egg freezing. So for those of you who listened in to that, first of all, thank you. And for those of you who haven't, definitely recommend going to go listen to that. But before we dive in, I would just like to add a couple of disclaimers. So from my side, all views expressed on this podcast are solely my own and Taryn's, and of no way reflection of the company I work with.
Yes. And a disclaimer my end is that although I am a qualified medical doctor, I'm not a fertility specialist. So all content that we'll be speaking about in today's episode is for educational purposes only, based on my sole research. And remember to always seek the advice of a healthcare professional with regard to any condition or treatment you may be seeking.
So with disclaimers out the way, really excited to dig into the topic of fertility. And planning for a baby is meant to be one of the most exciting times of your life, but I appreciate that it can also be one of the most stressful times of your life. There is so much information out there on the internet right now. Diets, the Mediterranean diet, what supplements you should be taking, what supplements you shouldn't be taking, microplastics, plastics in your brain, all of these kind of stuff, the processed foods, stress. There's so much out there, perhaps more for infertility linked to that. People are also having children in a lot of countries, older and older, which I appreciate also does impact on fertility. So I'm really hoping that today's episode can help empower our listeners to understand their body better and understand what's necessary to prepare for pregnancy, what that looks like, and if there are maybe struggles on the way, what alternative solutions has science presented to us, and what does that also look like? So really happy to dig in, and hopefully we can also cut through all the mist of all that information that's out there.
So am I.
So one of the kind of key questions I have is, okay, you're ready. You've thought through all the steps. I'm wanting to have a baby. What are some of the things you need to consider to start preparing your body? Let's say you're on the birth control pill or you're on some contraceptives. When should you start thinking about coming off that? What do you need to do on top of that to prepare your body? And what steps should you be taking?
Right. So I would firstly start off by saying that it really depends on what contraceptive method you are using. So assuming that you're on the birth control pill, I would say it would be advisable to stop it up to 6 months prior, just to get those regular cycles back in check, because it can take 2 to 3 months at least. And then following that, you want to have a few regular cycles. So my general advice, I'd say 6 months would be a recommended time frame for stopping the oral contraceptive pill. And the same would apply for an injectable, which typically takes a little bit longer to get out of the system. I just want to reiterate that all forms of contraception are completely reversible. So a lot of the time girls come up to me, they're like, oh my gosh, I'm so scared, I don't want to get this contraception, like maybe it'll make me infertile. This is completely not true. So if you are on any form of contraception, it will go out your system. So yeah, if you have an intrauterine device that's sitting inside the uterus, preventing pregnancy, hormonal or non-hormonal, I would say, yeah, obviously check in with your healthcare professional, get it removed, and then just check in with your body and see how long it takes to get your period back. And then following that, start preparing for pregnancy.
So what else should you be considering? What else do you need to do? Folic acid, I know that is something that's recommended, right, to take at the same time as you're coming off the birth control or contraceptive method. Vitamin D, appreciate, especially in more northern climates, is exceptionally important, where maybe we just see the sun a bit less.
Cool. Yeah, let's actually touch on all of these. So generally speaking, you want to prime your body for an optimal environment for pregnancy. So before we even touch on supplements, you just want to ensure that your body is healthy, strong, fit, ready to take on the immense challenge that is pregnancy. So if you eat a diet that's all-encompassing, healthy, anti-inflammatory, you're already there. Supplements, they're just nice additives, right? But the only supplement that is super important that must be taken is folic acid. In South Africa, all women go on folic acid, ideally 2 to 3 months pre-conception, because that's when it has its best effects to prevent what's called neural tube defects of the fetus. So basically like spinal abnormalities and things like that. So that is very important. That must be taken prior to conception. So just to touch the diet. So if you are someone who is experiencing endometriosis, PCOS, all these inflammatory conditions that we spoke to earlier, you really want to make sure that your body is in an anti-inflammatory state. And what that means for me might be different to what that means for you. So for example, if you're known with celiac disease, eating any gluten will further compound inflammation and stress your body out. So definitely identify the right diet for you. But generally speaking, you want to avoid processed foods, takeouts. You want to kind of cook from scratch and eat as healthily as possible, vegetables, and just make sure that your body is in an ideal and healthy state.
And I've heard particularly mentions with regards to the Mediterranean diet, right? Which is a lot of the fruits and veg, unprocessed, whole grains, I believe is also really important. So
Absolutely. I mean, when I was doing the research for this episode, there's no one prescribed diet. So in other words, there's no like South African guideline to say you must eat X amount of this and X amount of that. But generally speaking, you want to make sure that you've got a great source of omegas. Yes, you can supplement with omegas 3 and 6 specifically. But if you're consuming that in the diet, eating oily fish, obviously not high in mercury, like the tunas and the swordfish and all of that. But if you're just eating like 2 to 3 portions of fish per week, and if you are vegan or vegetarian, then perhaps supplementing with some omegas, that is a recommendation that I have stumbled across. But yeah, just healthy foods, green leafy vegetables, nuts, seeds, very important. Then vitamin D you mentioned. So when it comes to supplementation in general, I always advise first touching base with a healthcare professional. Informing the doctor that, you're wanting to undergo pregnancy, you've gone off the pill and, you're ready. And then maybe they'll check your levels, because it might not be necessary to supplement with vitamin D, for example, if you have high levels of vitamin D. But of course, as you correctly pointed out, lots of girls are deficient, and not only in northern territories, by the way, also in South Africa, which is really surprising because we have, a lot of access to the sun, but we all lead such office-like lifestyles. Very surprisingly, when I checked my levels, they were really low. So definitely touch base and get all your levels measured. I'd even say it might be wise to check out your thyroid, especially if you're symptomatic for a thyroid disorder, because that too can impact pregnancy. Your glucose, you want to make sure that you're not diabetic, because that can also have implications for pregnancy. So yeah, and then assuming you are low in vitamin D, it might be wise to supplement with that, because it has been shown to be a great immune modulator. It plays a role in hormone regulation and can be very beneficial for pregnancy, provided that you are low in those levels.
So what we have is, with regards to the pill or the contraceptive methods, you wanting to come off that a few months, even 6 months or so, and that you want to wait until your period regulates. And I do want to also touch on that and deep dive a little bit on that, building on our previous episode on menstruation. Then with regards to diet, unprocessed foods, healthy full fats, your nuts, leafy greens, omegas, all of that good stuff in your diet. And then folic acid, really important that you start taking that even before trying to conceive. And that seems to be more with regards to the fetal health, or the health of the baby, as opposed to your fertility levels. Is that correct?
Yeah, folic acid for everyone, of course, to prevent neural tube defects. Other researched supplements at the moment, which has popped up on my radar, would be coenzyme Q. So coenzyme Q is a powerful antioxidant. It's known to protect eggs from oxidative stress, and basically it's a factor known for improving egg quality. So studies are slowly starting to show that it may have a positive impact on fertility. However, studies are ongoing. So I certainly cannot come, on this platform and say everyone must take coenzyme Q, although I do see lots of fertility experts overseas already implementing this in their practice. It has been shown to be beneficial in enhancing mitochondrial function in the oocyte, so basically the energy cells of the eggs, improving energy production and egg maturation. However, from my research, I also noticed that coenzyme Q can be obtained from the diet. So is it necessary to supplement? Perhaps not. Coenzyme Q can be found in all the foods that we previously mentioned. So that fatty, oily fish, the nuts and seeds, veg and legumes. So if you're obtaining it from a diet, it may not be necessary.
Yes. There are so many prenatal vitamins out there, like huge amounts. And what I've also heard is that some actually aren't great. They're not great for your body, or they're not just doing much, or some people say it's just like expensive pee.
Yeah, I'm really glad that you mentioned that point, because a lot of it comes down to marketing at the end of the day. And a lot of the supplements that you're taking might be even contaminated with things, because there's no regulations when it comes to supplements. So I'd be very cautious to promote supplements on this platform. So I would really say, if you go get your levels checked and just make sure that your body's in a healthy state, it may not be necessary to supplement.
Okay, there's so much out there, and I think the best thing to do is just try to educate yourself as best as possible.
Yeah, and also have a scan, right? So that the gynae or the doctor can actually look at your ovarian follicles, see how prominent they are, perhaps take a level called an anti-Müllerian hormone level, AMH, which can be a good predictor of how a patient might respond to IVF, which we'll touch on later. So yeah, it's the clinical picture in conjunction with everything. It's not just a blood test. It's it's the ultrasound. It's the state of health of the patient, the lifestyle factors.
And just before we kind of move on, just one kind of question. Yeah, I've heard about the fact that really high intensity exercise is not great for your body before trying to conceive, because you're putting your body under a lot of stress. And then also, obviously, your stress levels. What are healthy tips? Because trying to conceive is very stressful, right? Too. So your body is probably going under stress. It's exciting, but it's also can be very stressful, especially if you are experiencing some difficulties in conceiving.
Yeah, absolutely. So look, being both overweight or very underweight, so being on both ends of the spectrum, can have an impact on your fertility. So you want to make sure that, yes, if you're exercising, it's to get your weight into a healthy, BMI range. So that would be important. But over exercising can shut down ovulation, because remember, the brain talks to the ovary. And so if the brain is perceiving that the body's under stress, it will prevent ovulation from happening and will have negative impacts on your fertility. So as a general guideline, women with a BMI of less than 25 who are attempting to conceive should limit vigorous exercise to fewer than 5 hours per week. So you want to be cautious not to overdo it, for sure. And stress has a huge role to play when it comes to ovulatory cycles. So if your body is under stress, you are likely to run into barriers when it comes to ovulating. And as we all know, we need to ovulate in order to become pregnant. So just to be mindful of that and get enough sleep, and also ensure that you're not smoking, because smoking can very much adversely affect ovulation, as well as alcohol, which is also highly inflammatory and stressful for the body. Not to mention, it can cause a range of problems for the developing fetus once you are pregnant, namely fetal alcohol syndrome.
So you mentioned ovulation a lot, so let's quickly jump into that.
Yes.
I know we touched on ovulation in our previous episode on menstruation, but how do you know if you're ovulating? What should you be aware of, and what does that actually also mean in terms of trying to conceive? And that's your window of conception.
Yeah. Okay. So biology 101, a woman needs to ovulate, right? And then once a woman has ovulated, the sperm will find its way to the egg and conception will hopefully occur. And a woman is considered fertile in the fertile window period. And this occurs 5 days pre-ovulation up to 24 hours post-ovulation. So it's nice to know when your body is going to be ovulating so that you can actually get on it the 5 days prior. It's got the highest rates of successful conception if it's within 48 hours pre-ovulation as well as the day of ovulation. But in order to know that, yes, you can follow calendars, but calendars don't take into consideration your specific biometrics. So there are way more reliable ways to tell that you're ovulating. The first way is the basal body temperature. Okay. So when a woman ovulates, the follicle releases the egg and then develops into what's called a corpus luteum. And this corpus luteum is essentially the remaining shell that releases progesterone. Progesterone then acts on the brain, the hypothalamus, which regulates body temperature. And it actually shifts the temperature up by 0.3 degrees Celsius, which is so fascinating. So as a nice little activity, a woman can measure her basal body temperature. This is by putting a thermometer in her mouth in the mornings. As soon as she wakes up, before she goes to the bathroom, she just sits in bed and she puts a thermometer inside the mouth. However, I would say that this is not a reliable method when wanting to fall pregnant because it's a retrospective diagnosis of ovulation. So you'd actually want to know before you ovulate that you are getting ready to ovulate. So it's very helpful to get in touch with your body's cues and know, oh, I've ovulated in retrospect. But it's not the best way if you're planning to conceive. But maybe as like an exercise, you could start already adjusting with your body and seeing what your menstrual cycle looks like when it's in its natural state. So it's not a bad way to just get in tune with your body, but also just to note that it can be impacted by viral infections. So if you're sick, that can falsely elevate the reading. So just to be mindful of that. But a more accurate assessment would be the cervical mucus. So cervical mucus is quite an interesting one. So before you ovulate, the follicle's releasing estrogen, and then that is priming the mucus in the cervical tract to thicken. And why it does that is because it wants to ensure that it's an optimal environment for the sperm to then travel across up the cervix, up the uterus, through the tubes, towards where the egg is chilling, waiting for conception. So around the time before ovulation, one might note that the cervical mucus is already becoming like a sticky, white, clear substance. And this is happening actually before ovulation occurs.
Okay, so super interesting. So, and that is that period. You mentioned the 5 days prior to ovulation. Ovulation then is what? Like it's just a couple of hours, right? It's like...
Oh, it's a second. Like boom, you've ovulated. Sometimes women can actually feel it. Not everyone, but yeah.
Super interesting. So, and I know there's like a whole lot of tests out there where you pee on the sticks.
So the urine sticks is actually measuring something completely different. That's measuring your luteinizing hormone, which is a hormone released from the pituitary gland of the brain, which is the hormone that shoots up 24 hours before ovulation occurs. So on peeing in a stick and measuring when your LH surge is going to happen, then that's another way of knowing, oh, I'm about to ovulate. But instead of just peeing on a stick for all the days leading up to ovulation, I mean, that could be quite tiresome, not to mention expensive. Maybe a better way to do it would be to look at your cervical mucus, notice changes, and then around that time, you can start peeing on the stick. And then you'll see a double positive line if the LH surges happen. And that is the optimal time to get frisky.
So that's the optimal time to get frisky?
Yeah, basically, if you want to fall pregnant, I would recommend engaging in sexual intercourse up to 5 days before ovulation, as well as 24 hours after ovulation. But if there's any doubts, just get frisky in general. No harm.
Because advice from Dr. Taryn Kowalski, get frisky in general. I mean, just, yeah. Anyways, I feel like we're going to have to put like a PG rating on this. So, but I've also heard that the sperm can live in the body up to 5 days, right? So can you still like fall pregnant if you have intercourse 5 days before your fertile period or window? Or is it just like, you know, that's those 5 days and the sperm is living, and then once you ovulate, that's bam.
Yeah, exactly. And 24 hours after ovulation. I mean, after 24 hours, the egg will soon start to disintegrate. So even if there is sperm living there, the egg may not be viable. So you definitely want to engage in sexual intercourse within the fertile window, up to 5 days before ovulation.
And super intimate question, but like there's a lot of things where you see on like movies, people are like lying with their legs up after having sex so that, you know, the sperm can travel, or like don't pee afterwards because, you know, then it flushes out the sperm. Is that all just old wives' tales, or is there actually any science behind that?
So there's no science behind that. So coital position has no effect on fertility.
Okay. And peeing after...
Peeing I would recommend doing, but that's just to prevent UTIs. So I would recommend peeing for sure, but it's not going to have any impact on your fertility.
So we've covered off a lot about how to best prepare your body, thinking through the actual moments of conception. Let's go into, you've done all of this, but you're not falling pregnant. Okay. And why is this the case? What should women also be aware of? A lot of women are also struggling more with falling pregnant because we are having babies later on in life. Also, all of these environmental factors that we've spoken about, stress, diet, things like PCOS, endometriosis, all of these factors. When should a woman sort of say, hey, actually, you know what, let me go and consult my healthcare professional? Yeah. And what are the factors that are involved in that decision?
Yeah, that's a good question. So I'd say really the answer is age specific. So because if you're over 30, I would not want to wait too long. Remember from one of our very first episodes, a female is born with all the eggs that she's ever going to have. And then over time, as she ovulates with each menstrual cycle, she loses her eggs. By the time she's 30, she has 10% of her egg supply. If you have been engaging in regular intercourse in the absence of contraception for over a year with your partner, you meet the diagnosis for infertility. So some people might not want to wait that long to consult with a healthcare professional, but technically speaking, you don't meet the diagnosis until it's been after a year. This is if you are under 35. If you are over 35, it's 6 months. So then you really don't want to wait longer than 6 months before checking in with a healthcare professional. If there's any doubt, of course, you may do so sooner, provided that you've gone off your hormonal method, just to see how your body adjusts. But I would say tread cautiously. So don't wait too long before just going in for that assessment, that check-in.
And say you go for that scan, you go for the check-in, and then you are deemed to be seen as kind of infertile. It doesn't necessarily mean that you can't have babies, right? It just means that you might need some assistance to fall pregnant. Is that correct?
So it depends on what the findings are. So if we can just quickly touch on the different causes of infertility, let's just quickly break that down. So firstly, it's important to mention that 30% of the time, the onus is on the male contribution. So 30% of the time, the female has absolutely nothing wrong with her tract or her hormones, her ability to ovulate. There's absolutely no pathology that's lying with the woman. It's sitting with the man. But in women, so I love to break it down anatomically, like where it can go wrong on an anatomical level. Just helps me understand it better. So if you have the ovaries sitting at either end of the fallopian tubes, conditions like PCOS, endometriosis, hormone dysregulation, so thyroid problems, autoimmune diseases as well. These are conditions that can affect the woman's ability to ovulate. So assuming there's nothing wrong there, you then move it along the tracks. Okay, what's wrong with the tracks? Maybe the woman's ovulating, but there's some blockages in the pipes that's preventing the sperm from reaching there. So factors that can affect the fallopian tubes would include previous pelvic inflammatory disease, which could be a severe complication of an STI, basically then causing fibrosis, so blockages along the tracks. Endometriosis also can have an impact on the tubes. Autoimmune conditions as well, just inflammation. Then women might have an anatomical variant of the uterus. So the shape of her uterus is not conducive to pregnancy. So maybe the pregnancy then implants, but then can't grow because the woman's got like fibroids or something that's obstructing pregnancy from happening. This can be picked up on an ultrasound. And then quite rarely you have got like cervical problems. So then down at the bottom is the entrance, the opening to all of this. The cervix, and sometimes there is a mass or there's a problem with the cervical lining that's preventing sperm from going up. So a doctor would obviously complete a very thorough examination of all of these factors, and then depending on what the issue is, it can be corrected. Most of the time it can be. If there are any problems along the channel, for example, then this is where IVF can be of assistance, because it can overcome all those barriers. You can just, conceive on a petri dish outside in a lab and then embed. Sometimes it's unexplained. So sometimes there's no problem with the sperm. There's no problem with the tracts, the anatomy, the ovulation. There's just no reason. There's no explanation. And then again, IVF can be of assistance here.
So I think, you mentioned about the males being 30% of the reason why maybe infertility does occur within a couple. I would love to dig into that and understand. But before we do, let's first unpack. Okay, you do have these issues, and I really like how you explain that along, kind of taking us through the journey, through the uterus, through the tubes, everything like that. What does that look like? That was a great way to paint that picture. But say you are having those issues, what are the steps that the doctor might take to help aid you in pregnancy? So you mentioned IVF, but is that kind of the first port of call, or are there other steps? There's other, medication you can take, other things that you would look to be doing before you maybe go on to IVF, and then would be great to touch on what's involved in IVF.
So I would say definitely first the doctor must identify the cause. Like, assuming that there's nothing wrong with the male sperm, is there something happening? Is the woman not ovulating? And if that is the case, the doctor can then assist the woman in ovulating, in administering hormonal injections, which can prime the follicles to ovulate. Sometimes it's just the case that a patient needs some assistance. So that would be a method there. Then there is a very specialist examination that one could do that's called an HSG. And this is basically like in a scan that just looks at the patency of the tubes, because if they identify that there's a blockage somewhere, then it's important to note that. But just knowing that there's a problem there is really important, because it can obviously conduct, what will be needed to do next. If there's an obstructive fibroid, this can be picked up on a scan, because then you can get the girl to ovulate as much as you like. But if there's going to be a problem with embedding in the uterus, you need to know about that and inform the patient of all these things. So really, it's a comprehensive assessment at the end of the day. You have the doctors to take in so many things into account. But most of the time, the causes are PCOS, endometriosis, very common hormonal conditions that we have touched on before. And generally speaking, that has impacts on ovulation. A lot of the time, because there's just so many confounding factors, the eggs are actually retrieved, and then you do it in a very controlled environment, on a petri dish, or via a method called ICSI, intracytoplasmic sperm injection. And that's where you pick up the sperm And you don't just put them on a dish and just like wait for the magic to happen. The doctor has more control over everything, and they pick up the viable sperm, and they ensure that fertilization happens in a more controlled manner. And then you reimplant them in a later stage. But a girl has to have eggs and has to be able to ovulate in order to do that.
So you'll be taking injections for IVF, so that fertilization outside of the body where you retrieve the eggs and fertilize in the petri dish, that would be IVF, right?
Yes.
But then the steps like the injections and everything that you would, and that IVF process is very similar to the egg freezing. It's just that the egg is then obviously fertilized and then put back into your body, right?
Yeah, the steps are similar. I mean, when it comes to egg freezing, you're just inducing ovulation. So that has to happen in order for IVF if you're going to be using your own egg.
Okay. And in the egg freezing episode, we've spoken about what to expect, the bloating, how you're going to feel during the injections, what to consider and everything like that. Is there also anything else to kind of consider as part of this? What also, miscarriages, all of those things to consider as part of going through the treatment?
Following fertilization, you then have to embed the embryo inside the uterus. And sometimes if you do it in the fresh setting, so in other words, that you've just done the IVF in the petri dish and you immediately implant it back inside the uterus, sometimes the body, after having received so many hormones, it's just not ready to accept the embryo, and no unsuccessful pregnancy occurs. That's why sometimes it's recommended to then freeze the already fertilized embryo, let the body calm down, then at a later stage you reimplant it. That would have higher success rates. But yeah, not having a viable pregnancy, that is dependent on so many other factors. So also the quality of the egg, the quality of the sperm, the stage of the cell cycle that the egg finds itself in when fertilization occurs. So yes, and that is actually really dependent on maternal age is a huge contributing factor to that. So it is better to have more youthful, fresh eggs, ideally less than 35. You'd see lower rates of miscarriage there for sure.
And there's also something with regards to the uterine lining, right? So the endometrium, how thick that is, right? Because I know that there are certain things that you could take before IVF, that like some pills that can trigger your ovulation, but they can have a tendency to make the endometrium lining thinner, right? So that's also a consideration as part of this.
I'm very impressed with your level of knowledge. But yes, so sometimes priming the body with like progesterone then buffers up that lining. It makes it ready to receive the fertilized embryo. And so yes, different hormones can be considered that in the different stages of the IVF process.
So you mentioned sperm health, and you mentioned percent of men also are the kind of attributing cause of infertility within a couple, which I think a lot of people don't realize. What should a man also be considering? Women have to go through all of these different steps to prime their body for pregnancy. What should men also be considering to make sure that they're priming themselves for conception?
So very much also just leading an active lifestyle or healthier lifestyle. So not being overweight, not smoking, limiting alcohol. All of these can have impacts on seminiferous tubal dysfunction, hypogonadism. These are all fancy words that are indicative of underlying male pathology. And then age also, interestingly, does have a role to play when it comes to males, which actually is something I didn't really think of. But we know that women in their late 30s are approximately 40% less fertile than women in the early 20s. But paternal age also does play a role, especially if the males are over 50 years old. I mean, it's not impossible, but age does have a minor role to play, not as much of a role to play as with females, but there is that also to take into consideration.
And do you think that's also part of the reason why more people are opting for IVF? Because I feel like all over my social media feed, and maybe it's just because we're of that age, I don't know, but all of my social media feed, a lot of my friends, a lot of my colleagues, etc., have been going for IVF or have been having more struggles with fertility and their fertility journeys. Do you think that is largely attributed to age? Do you think it's just a lot of those environmental factors or lifestyle factors that we've spoken to previously? Like, I'm really curious to hear your thoughts on this as a doctor.
Yeah. So the question of whether infertility is on the increase is actually a very nuanced question. So some studies actually show that it's not on the increase, and that it's just that women are delaying childbearing due to work life and wanting to advance in their careers. And it's because of the age alone that they're struggling to fall pregnant. So in other words, if you were to take a cohort of girls 35 pluses 100 years ago, you might too encounter high infertility rates. So is it actually increasing? I would argue it probably still is, and that's just because of the lifestyles that we're leading. It's not just the age; it's everyone's engaging in pro-inflammatory diets, sedentary lifestyles. Just the lifestyles that we're leading in general is just not conducive to good health, and we need good optimal health to undergo a healthy pregnancy. But then also it comes down to advancements in assisted reproductive technology. So because we have all of this at our disposal, people are coming forward and utilizing it. So of course we're seeing higher incidences of IVF, but that's just because we have the technology now. So it's a very nuanced answer.
I do think that there is something that people need to be aware of in terms of how do they manage their lifestyle factors, their stress factors, and then how to optimally prepare themselves for pregnancy.
Yeah. I just also want to reiterate here, like to all the listeners, all women that might be thinking that they're failures, they're trying all these things and it's the most disheartening feeling in the world. I just want to emphasize here that it's really not your fault. As women, we're navigating hormonal challenges that's shaped by societal pressures, sugar-laden diets, as alluded to earlier, and erratic work hours, relentless cultural expectations, and then the weight of motherhood as a presumed destiny that we all have to face. I mean, this all contributes to the stress burden. And then, the stigma of falling short of all of this further compounds the matter because it just further adds to the stress burden. So it's really tough. It's tough for women, and I empathize. I really do. And yes, you have my full support.
So thanks so much, Ta. It's been such an interesting and enlightening discussion. I think it is such a sensitive topic, but what I'm really hearing from this is also, again, just reiterating how important it is to know your body, know your body's cues, understand when you might be ovulating, maybe what's happening in your body that's preventing that, and then to always seek the help from a healthcare professional when you are thinking to conceive and chat through that journey. We are so lucky that we're living in a world today where there is increasing scientific advancements that are allowing us to have healthy, beautiful pregnancies. So thank you so much. I think there's so much more that we can cover and discuss, and we can probably talk for hours about this subject. But thank you so much for listening in, and would love to hear from you. Would love to hear your feedback. If you have any other questions, please do reach out to us, and please don't forget to subscribe. This is a way that we can also help to try get this podcast out to more people and hopefully help more people in understanding what's going on in the health and wellness space, and just to kind of cut through some of the noise that's going on, especially on social media. And thanks so much.
Thanks so much, and thanks all for tuning in. The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. See you soon, follicle friends.